Hi, everyone. Coming to you live on Room Now from ACR Convergence 2020. I hope everyone's having a good virtual conference so far. There continues to be a plethora of spondyloarthritis abstracts. I wanted to share and discuss an important but sometimes forgotten population, which is our female patients with axial spondyloarthritis. There were many interesting abstracts, but I wanted to also focus on a very important topic for our young female patients with AxSpa, and that's pregnancy and pregnancy outcomes. So the first abstract is abstract 1498, and that was actually an oral presentation by Dr. Magner. And this actually involved 4 prospective cohort studies in Europe. And they looked at pregnancy outcomes and health of children in women with AxSpa. They looked at over 300, they looked at 328 pregnancies. And they actually had some favorable outcomes of the pregnancies. 3% had preeclampsia, 6 to 9% had gestational diabetes, and preterm birth rates ranged between 0 to 5%. And that was actually pretty similar to the WHO general population rate of 9% in Europe. The next abstract is 1323, and that was a systematic review and meta-analysis. Reviewed over 18 studies with over 3,000 women analyzed. There was an increase in both preeclampsia with an odds ratio of 1.3 and an increase in intrauterine growth restriction with an odds ratio of 1.17. There was also a statistically significant increase in C-sections with an odds ratio of 1.85, which I don't think is, highly irregular. And there was actually a disease activity variation with actually 48% reporting increased disease activity during pregnancy. Unfortunately, there was not much data on medication use in pregnancy in this meta-analysis. I think it's interesting because we tend to think our patients with inflammatory arthritis have an improvement of symptoms during pregnancy, but this review showed that almost 50% had increased disease activity. And the last abstract is abstract 1324, and this was another prospective study looking for adverse pregnancy outcomes in 2 European centers. This included patients with psoriatic arthritis, AxSpa, and undifferentiated spondyloarthritis. The most common adverse outcomes was small for gestational age. They did note that inflammatory bowel symptoms and aggressive disease phenotype, which they classified as requiring 2 or more either conventional or biologic DMARDs, and active disease before or during pregnancy increased the risk for adverse outcomes. However, they didn't find any difference in age or use of steroids. Overall, I think it's been really nice to see an abundance of data on pregnancy outcomes this year, especially focusing on AxSpa, especially so much prospective data, because most studies thus far have been very heterogeneous and retrospective. I think a few things we can take away is, one, I believe the old adage still maintains, which is healthy mom, healthy baby. Number 2, in the prospective data, we're seeing a lot of positive signs in terms of adverse pregnancy outcomes in our female patients with AxSpa. And lastly, I think we just need to continue to build more registries and obtain more prospective data, especially given the use and the introduction of newer biologics in this population. So thank you for tuning in. I hope you continue to follow Room Now for the latest coverage of ACR Convergence 2020. Again, this is Dr. Robert Chao, and follow me on Twitter at Dr. RBC. Thanks.